When I was about 10 or 12 years old, I wanted to be a veterinarian. And I worked for a veterinarian when I was 15, 16, and through high school, and then went to Auburn University for 7 years to become a veterinarian. Moved up here in 1980, opened up this clinic. Hello, I'd like to speak today about the value of regular checkups. Regular checkups start with your veterinarian, both on dogs and cats. Just a quick way of looking at it is, say there is one human year for every 7 dog or cat years. So if you bring your dog and cat into me or your veterinarian once a year, that means they're only getting a checkup or looking for problems once every 7 years in their lives. So it's important to get regular checkups. Any animal over 6 years old is a high possibility of getting periodontal disease, so it's always nice to check, see if they have any kind of teeth problem. You can tell this at home by smelling his breath. If his breath doesn't smell nice or fresh or smells rotten, then they probably have periodontal disease and they need a teeth cleaning. They need to check their eyes. As dogs get older, they end up with what's called lenticular sclerosis, which is dog cataracts basically, and a little whiteness in the back of the eye. So it's always important to check that. We check the ears, looking for ear mites. So if you see ear mites or they start digging at the ears a lot, those are probably ear mites. We check for arthritis in the limbs as they get older. Dogs like Labradors, German Shepherds, a lot of times have a problem with hip dysplasia. So we try to check that and see how their hips are sore or whether they're getting around pretty good. We check overall for lumps and bumps, of course, looking for various types of tumors, growth, masses, things like that, that if we can catch them early enough, we can take care of them much more effectively than waiting until they're advanced and out of control. We check the skin and the hair, looking for problems such as fleas, ticks. We have lice in dogs, and so all sorts of problems. Fleas in particular, as we're approaching the summer, can be a real serious problem and cause continuous problems year-round in some animals. Flea control usually involves monthly flea control nowadays. It does an excellent job. But fleas can transmit tapeworms from one dog or cat to another dog or cat, so it's important to get rid of the fleas to get rid of the tapeworms, which can cause dogs and cats to lose weight. As part of a full annual vaccination or annual examination, we routinely do heartworm testing to look for heartworms. Heartworms are spread by mosquitoes from one dog to another dog with less chance in cats, but always there's a possibility. We do a fecal exam looking for intestinal parasites. Some parasites, such as roundworms and hookworms, can be transmitted to kids and can cause a problem. So it's one reason we always stress checking that. Ascaris roundworms or ascaris can cause blindness in kids if it happens to migrate to the eye, so that's important. It's never happened to me, but I don't ever want it to happen. I want to retire without it. So that's what's going on. We do routine vaccinations such as distemper, parvo, leukemia if it's a cat, and it's a state law that all animals over 3 months old have a rabies shot either 1 or 3 years. So make sure your rabies shots are up to date. Make sure the fecals are up to date and there's no parasites. Make sure the heartworm tests are up to date, because treating heartworms once they have heartworms, because they're really complicated and can be very strenuous on the dog or cat. So we do a physical from the tip of the nose to the tip of the tail, one end to the other. We check all the way through. You can do a little bit of a brief one at home, but it takes your veterinarian, and his, years of school and education to really look at for those things that are harder to see sometimes, such as the lenticular sclerosis, such as the pharyngitis, such as a heart murmur that, that we'll have to auscultate the dog or cat in order to see, or hear, excuse me. And so it takes various things. A lot of times we'll palpate the abdomen, looking for masses in the abdomen. We can listen to the heart, how it's doing, whether the lungs are filling up correctly. So it's important for a full physical exam on a yearly basis. The vaccines are important, the fecal's important, and the heartworm test, but not as important as just a general overall looking. Just like you'd go to your own family doctor once every 7 years, hopefully at least. Once a dog or cat has reached 6 years old, they're already over 50 years old, basically, in dog or cat years. So it's already important to really get them in, let them look at it. Older dogs and cats, as they get older, it's important, maybe even have to go to twice a year. It's really important to do blood work as they get older, too, to test for kidney problems, liver problems, things that we can head off when they're small instead of waiting until the very end. So my recommendation is once a year, bring your dog or cat into the veterinarian, have them checked up, make sure they're healthy so that you can enjoy the maximum life of your pet.